So, starting with the first topic of gynecology, topic is adenomyosis. Adenomyosis is a condition where this ingrowth of endometrium, both glands and stroma, directly into the myometrium. As you know, the uterus has three layers. So, in this, it is a condition in which there is ingrowth of endometrium, uh, both glands and stroma into myometrium. So it is a condition in which there is ingrowth of endometrium, both glands and stroma into the myometrium. So earlier it was known as endometriosis interna, and we have to differentiate it from endometriosis, uh, which I will be teaching you in next lecture. Okay, so now what are the similar features, like why it is so similar to endometriosis? Because the same age group is affected as like endometriosis, the same presentation of pain and dysmenorrhea, and same ultrasound findings. That's why. Take care. Now if I just have to know about the age group, so mainly in the reproductive age group, as it is also an as I say estrogen dependent condition, but mostly uh, if I just say in the mature reproductive age group, like more than 40 years. Okay, more than 40 years, mainly in multi paras female. Okay, and symptom, if I just want to know about symptom, the most common symptom which occur in adenomyosis is menorrhagia. Okay, and the second most is dysmenorrhea. So it presents with menorrhagia as well as dysmenorrhea. So age group, reproductive age group, and presentation is symptoms menorrhagia and dysmenorrhea. Okay. So now if I do per vaginum, so what I will find on per vaginum is on per vaginum there is a symmetrical enlargement of your uterus, and the enlargement like POG जिससे बात करते हैं, the enlargement will be less than 12 to 14 weeks of pregnancy. Okay, and the mobility is not restricted, and there is no associated adnexal pathology. Okay, this is it. Yeah, it's like symmetrical enlargement. It's also known as globular uterus. Okay, globular. As if I see in endometriosis, the uterus is irregular, lumpy, bumpy uterus, and on touching, it will be tender, and in endometriosis, it will be non-tender. And as I just mentioned, that POG will be like pregnant uterus will be like about 10 sorry, not POG, it's like 12 to 14 weeks pregnant uterus. Okay, and in the endometriosis, it grows up to 20 weeks. So these are these features from which I will differentiate adenomyosis from the endometrium. Otherwise, it will be difficult from the clinical presentation and ultrasound. But on PV, I have to know about because the treatment modality is different. Okay, uh, and this is there is one Halban sign. What this Halban sign means? Halban sign means uh, tender, soft, soft uterus on premenstrual bimanual examination. This is okay. Now I have to make a diagnosis. So what are the diagnostic modalities we use? Okay. So this is a per vaginum. Now I will teach you about the diagnosis, how to make a diagnosis. So the diagnosis, the first investigation will be ultrasound. Okay. So what I will found on ultrasound, there is a diffuse myometrial bulkiness because there is like ingrowth of endometrium into myometrium. So myometrium will be thickened. So there is a diffuse myometrial bulkiness. Okay, and on ultrasound it will be say like myometrium is heterogeneous with hyperechoic area, which will represent like endometrial glands. Okay, and there's also is a heterogeneous means hyperechoic and hyperechoic both. Hyperechoic means it will represent endometrial glands, and hypoechoic area means it will represent the muscle hypertrophy. That's why heterogeneous, and this heterogeneous appearance is known as salt and pepper appearance. This salt and pepper appearance you will see in medical sciences, very like in the skin. I just want to give you salt pepper DVs like for you if you are preparing for PG entrance. Salt and pepper appearance. Even a fundus like an eye, it will be in the rubella, the fundus in the eye. Retinitis pigmentosa, syphilis, and rubella, retinitis pigmentosa, syphilis, and one more condition, myotonica dystrophica. Okay. On skull, it will be like in the hyperparathyroidism. And also in the skin, I don't remember the condition. I will tell you in next class actually. Also in the skin. Maybe lupus vulgaris. I don't know. I don't remember this. Okay. The salt and pepper appearance. Now if I teach about the there is a myometrium and endometrium. So the this is like a transition zone. To the thickness of transition zone, like thickness of transition zone, thickness of transition zone will be like more than 12 mm thick. Okay, there will be sub endometrial persist. This is specific sign. Okay, there is also sub endometrial striations, which are known as Ventian blind sign appearance. Sorry, Ventian blind appearance. Ventian blind appearance. This is ultrasound. So in ultrasound, what we will see, there is a diffuse myometrial bulkiness. There is a myometrium is heterogeneous with hyperechoic as well as hypoechoic. Hyperechoic areas represent endometrial glands and hypoechoic areas represent muscle hypertrophy. And this whole appearance is known as salt and pepper appearance. That thickness of transition zone will be more than 12 mm thick. There is some endometrial echogenic nodules and cyst, which is a specific sign, and there is also some endometrial striation called Ventian blind appearance. Now this is the first investigation, the investigation of choice. The investigation of choice will be MRI, and what we will see, there's a the transition zone, like between the myometrium and endometrium will be more than 12 mm, and the uterus will be enlarged. Okay. Now if I do histopathology findings, the histopathology pay the endometrial glands which are present in the myometrium and surrounded by stroma. And on the myometrial cells show hyperplasia and hypertrophy. Sorry for the bad handwriting. So the MCQs will be like investigation of choice is MRI, and the gold standard is HPE after hysterectomy. Okay, so how will we are managing this condition? So management, the treatment of choice is surgery, and the surgery, the total hysterectomy. As most of the patients are more than 40 years of age, like, so there's no issue of family and family planning and all. If it is a younger woman, then we will give progesterone only pills, yeah, IUCDs, GnRH, etc. And recently we are also using uterine artery embolization. Okay, POPs are given, OCPs are not given. OCPs are not. Okay, OCPs are not given. So this is a treatment modality of adenomyosis. Thank you.